Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, Steve Daly. It's Monday, August 18th. Today on HITshow, 5 stories that matter for health system leaders.
Advocate Health pledges $3 billion to strengthen rural care.
Bupa opens a £6 million training academy to support the NHS.
Hackensack Meridian is rolling out selfie-based access to MyChart.
HealthEx and partners launch a TEFCA-Compliant patient identity platform.
And Maven Clinic expands with cycle tracking and male fertility tools.
Let's begin with a major commitment to rural healthcare. Advocate Health has released a new report outlining a $3 billion annual investment to expand facilities, strengthen services, and develop the workforce across rural America. Here's Teresa Vaughn.
That report underscores Advocate's mission to serve nearly 900,000 rural patients across its footprint. I spoke with Dr. Tom Anderson, who explained what drives this commitment.
We have a very strong 4L mission that we're very passionate about, and that extends into a really significant rural footprint that we have, taking care of close to 900,000 patients.
I asked Dr. Anderson, what does that investment look like in action?
And each year, we're looking at $3 billion in annual investment and growing, which gets to programs that, again, keep people close to home, programs and facilities that support workforce and the workforce ability to have the training and the growth to deliver that hands-on care.
Anderson emphasized that the guiding principle is equity, ensuring rural communities have the same access to quality care as urban areas. He called it part of the system's DNA, healthcare for all.
That's a bold commitment at a time when many rural hospitals are struggling just to keep the doors open. It'll be interesting to see how these investments reshape access across those regions. Now we turn to the UK, where a major new investment is taking shape. Workforce shortages are straining both public and private healthcare, and one of the world's largest providers thinks it has part of the answer. Here's field reporter Xavier Banks.
Thanks, Steve. Bupa has announced the launch of a new £6 million clinical academy aimed squarely at the UK's workforce shortage. Vacancies in the NHS currently top 100,000 positions, including more than 40,000 nursing roles. The academy will provide training and career development for hundreds of staff every year, from nurses to allied health professionals, helping to backfill critical roles across the National Health Service and private systems. The Academy is part of a broader trend, private providers stepping in with educational and training investments to ensure a future pipeline of skilled workers. Bupa leaders say this initiative isn't just about hiring for their own network, it's about strengthening the overall healthcare system, which continues to battle vacancies in nearly every clinical category.
Xavier, the NHS has struggled with workforce shortages for years. Do you think initiatives like this will actually move the needle, or are they more symbolic?
Steve, it's definitely incremental, not transformational. Training a new nurse or clinician takes years, not months. But Bupa is signaling that waiting on government fixes isn't enough. They're investing in workforce resilience now, and that may encourage other organizations to follow suit.
Slow and steady progress, but in a system as stressed as the NHS, even incremental change matters. We'll be watching to see how this plays out. Coming up after the break, a New Jersey system turns to selfies for secure portal access, a new national identity platform under TEFCA, and a fresh set of fertility tools from Maven Clinic.
HITshow is made possible by Altera Digital Health's Sunrise EHR, the flexible solution that provides tools and technology clinicians need to deliver better care, their way. The journey toward the summit of healthcare has begun, and through partnerships built on trust, Sunrise is helping healthcare organizations bring next-level care within reach.
Now let's turn to digital identity in patient access. As more hospitals roll out online portals, security and convenience are both on the line. One system in New Jersey thinks biometrics may be the answer. Here's field reporter Nate Collier.
Hackensack Meridian Health is piloting a new way for patients to access their health records, no passwords required. Instead, Epic's MyChart portal will now allow patients to log in with a selfie using biometric facial recognition to verify their identity. This marks one of the first Epic MyChart instances to move into biometric login. Others are watching closely to see if patients adopt it. The initiative is designed to reduce frustration with forgotten passwords while tightening security at the same time. Leaders at Hackensack Meridian say the new login system will make it easier for patients to check lab results, schedule appointments, and manage prescriptions without the typical hurdles of password resets.
Nate, this feels like one of those small things that could have a big impact. What kind of risks are hospitals taking on when they shift to biometric logins?
That's a key question. Advocates argue biometrics are actually more secure than passwords, which are often reused across accounts and vulnerable to phishing. But privacy advocates warn that storing biometric data brings its own challenges, especially if there's ever a breach. Hackensack Meridian says the data is encrypted and never stored directly on the device, but adoption will depend on whether patients trust the process. For now, it's optional, meaning patients can still use traditional logins if they prefer.
So we'll see if convenience outweighs privacy concerns. Either way, it's a clear sign that digital identity is becoming central to the patient experience. Thanks, Nate. Next up, HealthEx is stepping into the interoperability spotlight with a new identity platform designed to align with the federal TEFCA framework. Here's senior correspondent Peter Betterworth.
Thanks, Steve. The platform aims to make it easier for health systems and payers to securely exchange patient information while staying compliant. This is about creating a trusted identity layer for nationwide health data exchange. By linking patient identities more accurately across systems, HealthEx says they can cut down on duplicate records and improve both care coordination and billing accuracy. Analysts say identity management has been one of the biggest bottlenecks in scaling TEFCA, so early entrants like HealthEx may shape adoption patterns. The move positions them as one of the early technology providers ready to support CMS's push for stronger data interoperability.
So, in other words, it's less about shiny new features and more about laying the groundwork for trust across networks.
Exactly. It's the plumbing that makes nationwide interoperability possible, invisible to patients, but critical to the system running smoothly.
Thanks, Pete. Let's close with digital family health. One of the category leaders is widening its toolkit to support both partners on the road to conception. Jade Romero has that story.
Maven Clinic is expanding its virtual care platform with 2 additions: a new in-app cycle tracker that offers personalized predictions and guidance, and an at-home sperm testing kit with results integrated back into the experience. The goal is to bring both sides of preconception into one coordinated, clinician-backed workflow, connecting tracking data, testing, and care navigation with access to coaches and specialists. Executives say the update reflects rising employer and health plan demand for comprehensive, evidence-based fertility support, moving beyond point solutions to a single program that can progress from trying to conceive into pregnancy and postpartum without forcing members to switch apps or care teams.
Jade, lots of fertility apps promise smarter tracking. What's the practical difference here for health systems and employer clients?
2 things: integration and accountability. Because Maven already runs a benefits platform, these tools plug into care navigation, messaging, and referrals so members can move from self-tracking to a consult or care plan in a single flow. And for sponsors, there's clearer utilization and outcomes tracking than with standalone consumer apps.
From fertility support to pregnancy to parenting, Maven is broadening its reach across the reproductive journey. It's one more sign that digital health is expanding from treating illness to supporting life's milestones. That's all the time we have for today. Thank you for joining us on HITshow. If you like these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. HITshow is made possible by
Kimmchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you, Kimmchi.com.